In this class, we are starting with the discussion of parotid region. Okay. In the parotid region, we have two important structures to discuss. The very first one is parotid gland, and the next one is facial nerve. So, in this class, we are discussing in detail about the parotid gland. Facial nerve, you will be having one more class. Okay. Related to the parotid gland, we are discussing about the facial nerve also. Anyway, you will be having one more class for that. We'll start with the parotid gland. Your parotid gland is the largest salivary gland present in the body and it weighs around 15 grams. It is situated below the external auditory meatus between the ramus of the mandible and the sternocleidomastoid muscle. The gland overlaps these structure anteriorly. The gland also overlaps the masseter muscle. A part of this forward extension is often detached and it is known as accessory parotid duct or gland, and it lies between the zygomatic arch and the parotid duct. So your parotid gland is the largest salivary gland present in our body and it weighs around, stop talking, and it weighs around 15 grams. It is present below the external auditory meatus and it is present between your sternocleidomastoid muscle and the ramus of the mandible. Okay. You can see here, this is the parotid gland which is present below your external auditory meatus. And it is present, this dotted structure what you are seeing here is the ramus of the mandible and this is your sternocleidomastoid muscle. So basically your parotid gland is present between the ramus of the mandible and the sternocleidomastoid muscle below the external auditory meatus. Okay. Next we have an important structure called capsule of the parotid gland. Capsule is nothing but the covering of your parotid gland, that we call it as the capsule. Now imagine this is your parotid gland. Okay. This is the left side and this is the right side. On the right side, from anterior to posterior region, first we have skin. Next to the skin, it is followed by your superficial fascia. Stop talking. Okay. After the superficial fascia, we know we have a deep fascia. In this layer, we call it as a investigating layer. Okay, that is your deep cervical fascia. Now I'll start from this region in the posterior part. Imagine we have a sternocleidomastoid muscle here. Okay, this is your capsule, which is a single layer. To cover your sternocleidomastoid muscle, it divides into two layers. Okay, one is the outer layer and the another one is the inner layer. Okay, after covering your muscle part, it will again combine. Before covering your parotid gland, it will again split into two layers. Here it is called superficial lamina and this part is called deep lamina. Is it clear? Is it clear for everyone? The capsule of your gland is nothing but the deep fascia which has two layers, that is superficial lamina and deep lamina, that covers both your sternocleidomastoid muscle and also the parotid gland. Okay. The investing layer of the deep cervical fascia forms the capsule of your parotid gland. The fascia splits into two parts between the angle of the mandible and the mastoid process to enclose your gland part. The superficial lamina, which is thick and adherent to the or attached to the gland, is attached above to the zygomatic arch, and the deep lamina, which is thin, it is attached to your styloid process and also to the angle and posterior border of the ramus of the mandible and the tympanic plate. Okay. A portion of the deep lamina extending between the styloid process and the mandible, which is thickened to form the stylomandibular ligament, which separates the parotid gland from the submandibular salivary gland. This ligament is pierced by the external carotid artery, and the whole capsule is supplied by the auricular nerve. Okay. You can see here, this is your deep cervical layer. To cover your sternocleidomastoid, it is dividing into two parts. Again, it is combining to form a single layer before covering your gland. To cover the gland, it will again split into two layers. The outer layer is called superficial lamina of investing layer, which is also known as parotid layer, and the inner layer, it is called deep lamina. Okay. Next to the deep lamina, we have the styloid process. The deep lamina, which is attached to your styloid process, is called stylomandibular ligament. Any doubts? Any doubts in this? Okay. Next, we have external features of the parotid gland. We have apex, which is directed downwards, and we have four surfaces and three borders. The four surfaces are superficial surface, superior surface, anteromedial surface, and posteromedial surface. The borders are anterior, posterior, medial, or pharyngeal borders. Okay. So this is your parotid gland, which is pyramidal in shape. That means it has three-sided pyramids. Okay. This part is the apex. This is your apex, and it has four surfaces. The surface which you are seeing here is the superficial surface. Okay. And this surface is your superior surface. And this is anteromedial surface, and this one is your posteromedial surface. Next, we have three borders, that is anterior, posterior, and medial border. This one is the anterior border, anterior border. And this is the posterior border. Stop talking. And this is your medial border. Okay. And this is the parotid duct. These are the external features of your parotid gland. We have apex, which is directed downwards, and we have four surfaces: superficial surface, superior surface, anteromedial, and posteromedial surfaces, and we have three borders: anterior, posterior, and medial border, which is also known as pharyngeal border. Okay. Any doubts in this external features? Oh. Next, we have relation. Before talking about the relation, I'll mention few important structures related to your parotid gland. Okay. We have three important structures. The very first one is retromandibular vein. The second one is external carotid artery, and the third one is fascial nerve. Okay. Now imagine inside your parotid gland we have a retromandibular vein. Okay. This retromandibular vein at the apex of the parotid gland divided into two parts. This is called anterior division and this is called posterior division. Okay. On the base part, that is on the superior surface, it continues as the superficial temporal vein. Okay. And this part what you are seeing here is the retromandibular vein. Next structure is external carotid artery. Again we have external carotid artery. Okay. It enters your parotid gland through the posteromedial surface and here it continues as the superficial temporal artery. Okay. Within the parotid gland, it gives three branches. The very first branch is external auricular artery and another one is, stop talking, maxillary artery, and the another one branch is transverse fascial artery. Okay. We have external carotid artery which enters your parotid gland through the posteromedial surface and it leads as a superficial transverse artery. Okay. Within the parotid gland, it gives three branches. The very first one is auricular artery and the next one is maxillary artery and the another one is transverse fascial artery. These are the three branches of your external carotid artery. And the last one is fascial nerve. Here we have the fascial nerve. Okay. What are the branches of fascial nerve? How many branches are there? 5. What are those? The very first one is temporal branch. The second one is zygomatic branch. Next we have upper buccal branch followed by lower buccal branch. Then we have maxillary branch. The last one is cervical branch. Okay. These are the few important structures and their branches present within your parotid gland. You have to remember. Any doubts? Any doubts in this diagram? Any doubts in this diagram? Okay. Apex, it overlaps with the posterior belly of the digastric muscle and it is also related to the cervical branch of the fascial nerve and to the two divisions of your retromandibular vein. The two divisions of your retromandibular vein is anterior division and posterior division. Okay. Next we have surfaces. The superior surface, also known as the base, it forms the upper end of the gland which is small and concave. It is related to the cartilaginous part of the external auditory meatus, posterior surface of your TMJ and the superficial temporal vessels, that is your superficial temporal artery and superficial temporal vein. And it is also related to one more important structure, that is your auriculotemporal nerve which is present in the superior surface here. Okay. The next one is superficial surface. It is the largest of among the four surfaces. It is related to your skin, superficial fascia, and also the parotid fascia, that is the superficial lamina of your deep cervical layer, and it is related to your deep parotid lymph nodes. Okay. And the anteromedial surface, it is related to your masseter muscle, lateral surface of the TMJ, the posterior border of the ramus of the mandible, medial pterygoid muscle, and also to the emerging branches of your facial nerve. The last one is posteromedial surface. It is related to mastoid process, styloid process, external carotid artery and internal carotid artery. You have to remember four names here: mastoid process, styloid process, external carotid artery and internal carotid artery. Okay. Next we have borders. The anterior border separates the superficial surface from the anteromedial surface, and it is related to these structures: parotid duct, terminal branches of the facial nerve, transverse facial vessels, and also to your accessory parotid gland that lies along with the parotid duct closer to this border. Okay. Stop talking. The next one is posterior border. It separates the superficial surface from the posteromedial surface. It overlaps your sternocleidomastoid muscle, and it is also related to the lateral wall of the pharynx. You can see here, this is the structure which I have written here. This is your superficial surface, and this is the superior surface. This is posteromedial surface, and this is the anteromedial surface. This point is your apex, which is directed downwards, and this is the accessory parotid gland, and this is the parotid duct. On the apex region, it is related to your anterior division and posterior division of the retromandibular vein. Your anterior division later continues as the common facial vein, and the posterior division later continues as the external jugular vein. Okay. Near the ear region, we have posterior auricular nerve and posterior auricular artery and veins. Okay. In the ego region, we have superficial temporal vessels along with auriculotemporal nerve. On the anteromedial region, we have facial nerve and its branches. This is the temporal branch, zygomatic branch, upper buccal branch, lower buccal branch, marginal mandibular branch, and the cervical branch. These are the structures you have to remember during the relation of the parotid gland. Okay. Any doubts in this? This figure shows the attachment of the or relation of the muscles. You can see the medial pterygoid muscle, wall of the pharynx. Then we have styloid process, that means it is related to a stylomandibular ligament. Here we have posterior belly of digastric, then we have sternocleidomastoid muscle, and we have masseter muscle. Okay. There are so many other simplified picture of this in your textbook, so go for those picture if you find this one as difficulties. This one also, see your other textbook, there are many other pictures, go for whichever is easy for you. Okay. Next we have structures present within the parotid gland. It is nothing but these three structures which I have already mentioned: retromandibular vein, external carotid artery and facial nerve. While writing answer for structures within the parotid gland, you have to mention from which surface or from which border the structure is entering into your parotid gland, and from which surface it is leaving the parotid gland, and what are its branches. Okay. Arteries. The external carotid artery enters the gland through its posteromedial surface. The maxillary artery leaves the gland through its anteromedial surface. The superficial temporal artery gives transverse facial artery and emerges at the anterior part of the superior surface. So maxillary artery, superficial temporal artery and transverse facial artery are the branches of your external carotid artery that is present within the parotid duct. Okay. The next one is vein. Stop talking. We have retromandibular vein. It is formed within the gland by the fusion of superficial temporal vein and the maxillary vein. This is your MCQ question. Note down. Retromandibular vein is formed by the union of superficial temporal vein and maxillary vein. In the lower part of the gland, the vein divides into anterior and posterior division which emerge close to the apex of the gland. I have already mentioned this point. You can see here. This is the external carotid artery. It gives us three branches: auricular, temporal and maxillary. Later from the superior surface, it is leaving as a superficial temporal artery. Okay. And this is the retromandibular vein. It is forming from the fusion of your superficial temporal and maxillary vein. Okay. In the base or in the apex region, it is dividing into two branches: anterior division and posterior division. Posterior division later continues as the external jugular vein. Anterior division later continues as the common facial vein. The facial nerve, it exits from cranial cavity through the stylomastoid foramen and enters the gland through the upper part of its posteromedial surface and divides into its terminal branches within the gland. The branches leave the gland through its anteromedial surface and appear on the surface at the anterior border. Facial nerve lies in relation to isthmus of the gland, which separates the large superficial part and small deep part. So your facial nerve divides the entire gland into two parts, that is superficial part which is larger in size and deep part which is smaller in size. Okay. Remember the point, your facial nerve divides your gland into two parts, that is superficial part and deep part. Deep part is smaller in size and superficial part is larger in size. Facial nerve divides into two branches: temporofacial branches, that is temporal branch and zygomatic branch. The another one is cervicofacial branch, buccal branch, marginal mandibular branch and cervical branches. Okay. The next important structures are parotid lymph node. The another one is part is fasciovenous plane. This is also MCQ question, so note down this point. The gland is composed of a large superficial and a small deep part, the two being connected by an isthmus around which the facial nerve will divides. Okay. Next we have accessory process of the parotid gland. We have facial process, pterygoid process, glenoid process and post-styloid process. These are the four important processes of your parotid gland. Just note down this fifth point. You can see here, this is the facial nerve. It is dividing into 5 branches. And this picture shows the division of your gland into two parts by the facial nerve. The seventh nerve is facial nerve and this is the isthmus part. This is superficial part and this is the deep part. Okay. And this is the facial process. Any doubts? Any doubts in the relation? Okay. Next we have blood supply. The parotid gland is supplied by the external carotid artery and also from its branches. And the parotid gland will ultimately drain into your external jugular vein and internal jugular vein. Nerve supply. Parasympathetic nerves are secretomotor. What do you mean by secretomotor? What is the significance of secretomotor nerve? It is discussed in your general anatomy part. find out what is secretomotor and also the significance of secretomotor nerves. Okay. So the parasympathetic nerves present in your parotid glands are secretomotor in nature, and they reach the gland through the auriculotemporal nerve, which is present on the superior surface. Okay. And also the sensory nerves to the gland also comes from the auriculotemporal nerve region. Lymphatic drainage, lymph drain first to the parotid lymph node and from there to the upper deep cervical lymph nodes. Parotid lymph node. The parotid lymph node lie partly in the superficial fascia and partly in the deep fascia. They drain into temporal region, side of the skull. Note down these points also. Lateral surface of the auricle, external auditory meatus, middle ear, parotid gland, upper part of the cheek and parts of the eyelids and orbit. Again, parotid lymph node is also your MCQ question. They will give 4 structure name and they will ask which part of your parotid gland will drain into these structures. Okay. Next we have clinical anatomy. Parotid abscess is best drained by a horizontal incision known as the Hilton's method. Hilton's method is your short answer question, so give some importance to it when you are reading. The Hilton's incision or method will be followed below the angle of the mandible. Okay. This incision is made to preserve your facial nerve and not to damage it during the process of your removal of the parotid gland or during the draining of your parotid abscess. Okay. During surgical removal of the parotid gland or parotidectomy, the facial nerve is preserved by removing the gland into 2 parts, superficial part and deep part separately. To preserve the facial nerve and not to make any damage into your facial nerve, the removal of your parotid gland will be done in 2 parts. One is superficial part and another one is deep part removal. Okay. The next one is mixed parotid tumor. It is a slow growing lobulated painless tumor without any involvement of the facial nerve. Once the involvement of your facial nerve is seen, we can see the malignant changes. What do you mean by malignant tumor? What are the other type of tumor we generally see in body? Okay. What is the difference between these two? Okay. So once the malignant changes start taking place, the tumor will indicate a pain, rapid growth of your tumor cells and also the involvement of the facial nerve and enlargement of the cervical lymph node. So these are the 3 important clinical conditions related to your parotid duct. The first one is Hilton's method and the second one is parotidectomy, that is nothing but removal of your parotid duct without damaging the facial nerve, and the last one is mixed parotid tumor, or you can mention as malignant parotid tumor also. Any doubts? Any doubts in the parotid duct? In your parotid region, we have 2 important structures. The first one is parotid gland and another one is facial nerve. Okay. Your parotid gland is the largest salivary gland present in our body and it weighs around 15 gram to 25 gram. Okay. And it is present below your external auditory meatus between the sternocleidomastoid muscle and the ramus of the mandible. Talking about external feature, it has apex, base, which is also known as superior surface. Other than that, we have 3 surfaces, that is superficial surface, anteromedial surface and posteromedial surface. We have 3 borders, anterior border, posterior border and medial border, which is also known as pharyngeal border. Okay. Capsule of the parotid gland is also important topic. Capsule of the parotid gland is nothing but the deep fascia covering your parotid gland, which is known as invest layer of the deep cervical fascia. Okay. It gives 2 division. The first one is superficial lamina and the another one is deep lamina. Okay, and we have three important structures. The first one is retromandibular vein and another one is facial nerve and external carotid artery. External carotid artery gives us three branches, that is maxillary artery, auricular artery and transverse facial artery. In the superficial surface or in the superior surface, it continues as the transverse superficial temporal artery. Okay. Retromandibular vein give division at the apex, that is anterior division and posterior division. Posterior division continues as the external jugular vein and the anterior division continues as the common facial vein. Other than that, we have facial nerve. It gives us 5 branches: temporal branch, zygomatic branch, buccal branch, mandibular branch and cervical branches. And 3 important clinical condition. The first one is Hilton's method, that is nothing but horizontal incision to clear the abscess or pus formed in your parotid gland. The second one is parotidectomy, removal of the parotid gland without damaging your facial nerve. That is very important. And the last one is tumor. Okay. Any doubts? Any doubts in parotid gland? Okay, fine. Then we'll end the class. Thank you.